for our discussion today is knee deformities in children. As we have seen a lot of children, they don't have a straight leg. So either the feet, they are away from each other or they are close to each other. So we call them scientifically as genu valgum or genu varum respectively. And coming to the developmental growth development in children's. So as a child is born, he is born with the genu varum. So that means the knee are separated away, and the legs, the feet are close to each other. So that's we call genu varum. That's we call physiological genu varum. So which goes on to becoming neutral. That means the legs become straight at the end of about 18 to 24 months of age. So at that time, the child will have a normal straight leg. So that means the angle between the thigh and the leg will be 0 degrees. But as he ages more, the leg they tend to go outward. So till the age of 7 years, the genu valgum, where the legs they start going outward. So they go outward, and the angle between the thigh and the leg becomes about 15 degrees. However, as the child become older than 8 years, the legs start coming close to each other till they finally settle down at an angle of around 7 degrees, which remain for their whole life. So this we discuss is called a Selenius curve. So if any child falls outside that curve, if any child doesn't follow this pattern of growth around the knee, so we label that as a pathological problem. So that means it's not a normal problem. So those child demand further intervention or further investigation. So those child should be seen by a pediatric orthopedician. So basically, why this happens? So there is a process, there is a growth plate through which the growth takes place, and that's a normal that's normally placed in all the bones. That's how the child grows in size, grows in length. So if there is a differential growth, that means if the growth on the inner side of the knee joint is more than the outer side, so the legs will tend to grow out, or vice versa if it happens otherwise. So that is that is how the child develops all these growth patterns. However, coming to the causes, so the most common cause would be obvious malnutrition. So most of them will have either deficiency of calcium or a deficiency of vitamin D. So we need to correct those deficiencies in order to treat the child. Also, these defects, if they are very much visible, if they are cosmetically unacceptable, or if the parents come with a complaint that their child cannot run, or he has a history of he gets frequent falls while running, he is not comfortable, because in case of genu valgum, where the feet will be growing outward, both the knee will touch each other, and this causes discomfort to the child with while running, and even may cause frequent falls. So these kind of deformities or these kind of conditions, they demand further treatment in the form of surgery. Surgery is very, very simple in those cases if they are within the growing age. So that means if their physis, if their growth plate is still open, so it is very, very simple, very, very convenient for the surgeon as well as for the child. So here we exploit the principle of guided growth principles. Basically, we know that because of differential growth, as I discussed before, these children are developing the deformities. So what we do is we slow the growth of the faster side, and so that the slower side catches up with the growth on the faster side, so that the growing sides, both the sides, they grow equally, and hence by they kind of just correct themselves, and the deformities, they tend to be appear corrected. So like in genu valgum, suppose we know that the growth on the medial side is faster than the lateral side. So what we do is we put we give a very minimal incision at about 1 to 2 centimeter, and we put a plate, we call a 8 plate, around the 5-6, so which actually slows the growth rate on the medial side, while the growth on the lateral side is continuing at its own pace. So that both the growth, the rate of growth of both the sides become kind of almost the same, and hence by correcting the deformity. However, with these, if we are applying these principles, we need to be very careful. The child need constant follow-up, constant supervision, because sometimes what happens is these kind of deformities, they tend to overcorrect, and this becomes very problematic both for the children and for the treating doctor. So this needs a constant follow-up apart from correcting all the deficiencies. Thank you.